Hello everyone. So this is the first video in my channel. So let us start with some with a quote which I wrote few days back. The best time to start something may be yesterday, but the second best time is right now. So with this we start a journey into medicine. So today's topic is Glasgow Coma scale. So at first we look at the definition of Glasgow Coma scale. What is Glasgow Coma scale? I'm sure you guys must have heard this term, which is a famous term in medical field. It is an objective clinical system of scoring to assess the level of consciousness in a patient. So, it is an objective clinical system of scoring, right? It is not a subjective. So, it is well accepted in most of the fields. It is a scoring to assess the level of consciousness in a patient. So we go more into more detail of this in our further slides. So it is so you guys know, by now you have known that it is a scoring pattern. So it is assessed under three parameters. Uh, uh, these are eye opening, verbal, and motor response. We also denote these as E, V, and M, right? So the total score of Glasgow Coma scale is 15. Each of the parameters have got some scoring to them. The scoring for eye opening is 4, for verbal response is 5, and for motor response is 6. We must remember that the score in whatever condition the patient may be, the score is never 0. The minimum score of GCM, sorry, the minimum score of GCS is 3. So you can understand that uh, the minimum score for each of these parameters, that is eye opening, verbal response, and motor response, is at least 1. So first we look at the eye opening. So a patient comes to you, sorry sir, I mean somebody brings a patient who is unconscious. So at first you assess the for assessing the GCS score, you must assess the eye opening. If a patient spontaneously opens the eyes, the score is 4. If he is not opening the eye spontaneously, but he is responding to your verbal commands, like you shout out his name, you call him by his name, and he responds, then the score is 3. If he, if the if he does not respond to your verbal command, then but you provide him a pain stimulus, which may be in the area of his palm or his sternum, the score then, and if he opens his eye to pain stimulus, then the score is 2. And if in all of this situation he does not open his eyes at all, then you give him the score of 1. As I have already said previously, there is no 0 scoring in any of these parameters. The minimum score is 1. Now we come to the second parameter, the verbal response. The maximum score is 5 for verbal response. Score of 5 is given to an individual who is in normal conversation with you. That is, you assess his response to time, place, and person, and he responds in a normal way. Then his verbal response score is 5. If while talking to you, the patient you feel that Patient is confused, like not reacting in a normal way. His words are appropriate but he feels confused, then you give him a score of 4. If the patient is chanting inappropriate words, then a score of 3. If the words are incomprehensible or there are only sounds or moans, then 2. If he does not produce any sound or there is no any verbal response, then the score is 1. We also know, we also get to know that in any of these response, in any of these indices, if the any of the test cannot be assessed, then we write it as anti. The third parameter is the motor response, and I must tell you that this is the most important or the best predictor of neurological outcome. The the total score of the highest score given to motor response is 6, and the, as you have already known, the minimum score is 1. If a patient obeys your command, for example, you tell him to raise his hand, he raises his hand. You tell him to bring out his tongue, then and he does so, then you give him a score of 6. If the patient does not obey command but can localize the pain given to him, then the score is 5. If the patient withdraws from a pain, we give him a score of 4. If the patient cannot withdraw blood but flexes the arm towards the pain, then we give him a score of 3. But if the patient extends his arm instead of flexing his arm uh, to pain, we give him a score of 2. And if there is no response, we have already known many times, we have said that the score is 1. Now I must tell you about the two positions, the decorticate position and the decerebrate position. Decorticate position refers to the flexion 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 of arms plus extension of legs. Okay, so decorticate position is the flexion of arms and extension of the legs, whereas decerebrate position is extension of both arms and legs, extension of both arms and legs. So are you all oriented up till now? Okay, then let's move ahead. We have moreover learned about the GCS scoring system. Then what is GCS P scoring then? So in order to make things simpler, in order to simplify, the GCS score and the pupil reactive score were combined into a single simple index, that is the GCS P scoring system. This scoring system came out in around 2018. So how do we calculate GCS P score? To calculate GCS P score, at first we should know the pupil reactive score. Then what is the pupil reactive score? I must tell you guys that it is a scoring system to assess the reactivity of the pupil. The scoring system, the highest value of the pupil reactive score is 2 and the minimum value is 0. It is not 1 in this case. So when do we give pupil reactive score of 2? If both pupils are unreactive to light. I must concern you guys here about this confusion you may get. So both pupils are unreactive to light, then we give a score of 2. It is not that if both pupils are reactive to light we give a score of 2. It is that both pupils are unreactive to light we give a score of 2. That means the ideal score for us is sorry the ideal score for the ideal score for us is sorry for this mistake, it is both pupil reactive for us is 0, and the minimum score for pupil reactive score is 2, which means when we do the when we assess the reactivity of pupil using a torch light, both pupils are unreactive. That is, both pupils do not constrict to light stimulus. If only single pupil constrict and other pupil has no response, then we give a score of 1. Then how do we calculate GCSP score? It is still not explained. So we calculate GCSP score by subtracting the pupil reactive score which we just read from the GCS score. That is, GCSP score is GCS score minus pupil reactive score. Now you guys are getting it, I am sure. So we have read the definition of the GCS score, the parameters of the GCS score, the scoring system of the GCS score, even the GCSP score. But why is this GCS score necessary? GCS score is necessary to assess the level of consciousness in a patient. You all guys know this point, I am sure. But you may not know it is also used to assess the severity of head injury. Head injury is classified according to Bayesian log. Head injury is classified as mild, moderate, severe and very severe based on the scoring of GCS scoring of the patient. So if the GCS is 15 with no loss of consciousness, it is mild head injury. If it is 14 or 15 with loss of consciousness, it is moderate. If it is 13 and below but not less than 9, then it is severe head injury. And if it is 3 to 8, then we classify it as a very severe head injury. Then why is this severity of head injury essential? In case of planning the patient for surgery, we must in case of head injury, we should know the severity of head injury. All right, I must also tell you guys that a patient in coma will have GCS score of 8 or less. That is, we refer the patient as comatose patient if he or she has a score of GCS less than 8 or equals to 8. Another important point is if in any patient tracheostomy or intubation is done, then we denote the verbal component of the GCS by NT. For that is, suppose just for reference, suppose it is GCS is E2 VNT M2. So we denote the GCS as like this in case of intubated patient. So I've got you. So more or less this is, we need this much in our level of MBBS or MBBS in the topic of GCS. So I have collected some questions for you guys, so you can pause the video and try to answer the questions. What is the minimum GCS P score in case of head trauma? The answer is correct. It is 1. Some of you may be confused with the GCS score and the GCS P score. As we already discussed, the GCS P score, the minimum value of GCS score is 3. The minimum value of the pupil reactive score is 2. So we calculate GCS P score by subtracting GCS score and pupil reactive score, that is, we get 3 minus 2 equals to 1. So that is the correct answer. Now next question. Patient is confused, open his eyes on painful stimulus and flexes right arm in response to pain. His GCS score is. So we have to assess 3 parameters differently, that is eye opening, verbal response and motor response. Here patient open his eyes on painful stimulus, so his eye opening is 2. The patient is confused, so his verbal response is 4. And the patient flexes right arm in response to pain, so his motor response here is 4. So the answer here is 10. 2 plus 4 plus 4 equals to 10. Next question. Patient is confused, so opens his eyes on painful stimulus and flexes right arm in response to pain and can localize pain on the left side. So I left you guys with one concept, that is the best verbal response and best motor response. So here we have in motor parameter we have we have 2 things here. The patient can localize pain on the left side as well as he flexes his right arm in response to pain. So if we take flexion of right arm in response to pain, his motor response will be 3. If we take the localization of the pain, his motor response would be 5. So what should we do? So here comes the concept of best verbal and best motor response. We always take the scoring, we always take the best scoring of the patient. The patient here can the patient here flexes right arm in response to pain, but he can localize pain, which is his best capability. So we take the best capability of the patient, that is localizing the pain. So the question is asking the eye opening is 2, the verbal response is 2, and the motor response should be here 5. So we have a total GCS score of 11. So these are few questions which can come in your exams, and this is all about the GCS score. Thank you.